Aortic dissection is a tear in the innermost layer of the aortic wall that allows blood to flow between the layers and create a false lumen. Acute aortic dissections are classified as type A, in which the ascending aorta is always involved and requires urgent surgery, and type B, which does not involve the ascending aorta and can often be managed conservatively. After the first life-saving surgery, some patients are left with a residual tear and need a second operation to repair it. Being able to identify these patients early and accurately could improve long-term outcomes. This was investigated with a study involving 192 patients with acute type A aortic dissection who underwent urgent aortic repair surgery between 2012 and 2021. Patients were followed up for an average of 4.6 years, and those with a tear greater than 5 millimeters on the CT scans were offered a second operation in the form mainly of thoracic endovascular repair. Retrospectively, patients with no residual tears did not require a second operation, while 13 out of 14 patients with tears only above the aortic hiatus required a reintervention. Tears only below the aortic hiatus did not require surgery, 0%, while 28 out of 48 patients with tears on both sides needed to be reoperated. The data suggests that timely detection and closure of residual tears located above the aortic hiatus could improve acute type A aortic dissection outcomes by helping to avoid surgery in patients who wouldn't benefit from it.